everyone, it's Crystal and I'm here to do a 35-week pregnancy update. I know it's been probably a month since I last talked to you all, and as always, I'm sorry I've been busy, but I am doing really well. I am officially 35 weeks today and I am super excited. I can't believe that it's almost at the end. I'm at the end, I'm almost there. In my brain I tell myself I have like 4 weeks or less because excuse me, Josh and I just got back from eating. Josh's mom is watching the boys today, so we're having kind of like a little mommy daddy day break-ish. I have to go pick them up at 5 o'clock, but I was like, oh, it's perfect timing. I can do a video finally. So yeah, 35 weeks today. I'm doing really, really well. I know in my last video I talked about having gestational diabetes that I found out that I had. I failed the 1 hour and then I failed the 3 hour. So I did have to go to obstetrics and you know, was officially diagnosed with it. And so I have had to change my diet, and I test my sugar 4 times a day, and it kind of sucks, but it's not the end of the world. And actually I've been doing so well with it that I only have to test my sugar 4 times a day, 4 days a week. No longer is it every single day, but like I said, I've been doing a really good job at maintaining my sugar levels. Basically, I have to test them in the morning. You have a fasting test, and then you have to test them after every meal, 2 hours after every meal. So that's breakfast, lunch, and dinner 2 hours after I eat. So I've been doing really well. Ideally, they want your fasting number in the morning to be 95 or lower, and I've been keeping it at that. And then anything during the day after you eat needs to be 120 or less. So I have been keeping my numbers on point. And in order to do that, I've really had to change my diet completely. You know, you just really don't realize how some of the stuff that you eat every day that you don't think is crap. It really is. So I've really had to cut out I've cut out like carbs and sweets and all kinds of stuff like that. I'm eating a ton more vegetables and fruits and like steamed brown rice and whole wheat pasta instead of regular pasta. I'm really not eating any bread at all. Josh is cooking a lot of my meals for me. If we do get fast food, I generally will just get like a salad, or I'll get some chicken so that I have salad. I have greens here at home, so then I can make like a chicken Caesar salad whenever I get home. But I'm eating like yogurt in the morning and berries, and I love fruit and vegetables, so it's not a bad thing. I just wasn't eating as much of them as I should have. I was eating a lot of empty carbs and a lot of sweets. Oh, I miss my sweets. That's the one thing that's been the hardest to give up, obviously. But I have been giving them up. I do allow myself a little treat here and there. But if I do, it has to be very, very minimal. And it really, I only let myself have like a treat if if I know that I just really ate like a rabbit all day long. I mean, I'm eating enough food. But although like 2 weeks ago, last week, was it? It was last week, like almost 2 weeks now. I was at work and I was really busy, and I ate my normal breakfast, but it was kind of busy, I guess, later, and I didn't eat in time for lunch. I did eat, but I don't know what happened. My sugar got really, really low. So low, in fact, that I started to get really, really sick. My heart was pounding. I felt like my heartbeat was out of rhythm. I was having to I just felt really out of breath. So I called my midwives, and since I'm in my last trimester, they're like, go ahead and come in. Let's just check you out, make sure you're okay, because I have the history of preeclampsia. So they wanted to make sure that my blood pressure was okay and everything. So I went in and I went to maternal observation, and everything was fine basically, but my body just got overwhelmed. My sugar was incredibly low, and they basically were like, you need to add more protein to your diet. So in the mornings I've been adding eggs and things like that. So it's helping me sustain better, because I have been restricting my diet. It's not like I'm not eating. It's just that, whereas before I would grab something like crappy and just eat to feel okay in that moment. Now I'm not doing that. I'm keeping a more of a strict diet time, and I only eat at certain times of the day, really. But now I've learned to kind of integrate some other smaller things into my meals and in between meals so that I can still get through the day without like passing out. So overall, I'm doing really well with the gestational diabetes. Like I said, I'm taking care of it. I'm controlling it. I have to email my nurse my numbers. I email her every Tuesday. And like I said, last Tuesday, she emailed me back and was like, you know, the doctor is really happy with your numbers. You only need to test 4 days a week now. And I was like, ah, oh, sweet. So, but I'm still maintaining on those days that I'm not testing. If I'm gonna have a sweet treat, it's gonna be on that day, and it's only, like I said, it's a minimal sweet treat. That way I don't, you know, go over and make my body get all crazy. So, let's see. I'm trying to think, I didn't write anything down. Doing this on a whim because, like I said, the boys are at my mother-in-law's house. So, okay, let's see. I feel like I'm losing my train of thought. So, let's see. 35 weeks, gestational diabetes is good. I have an appointment with the midwives tomorrow and just a basic checkup. And from that point on, I'm going to start going every single week. I'm now at the point, because I'm in my last, I'm like, really, I only have 4 weeks left because I think I may have mentioned this in my last video. Because I'm seeing my midwives and because I had a cesarean, I had to go and see the OBGYN that's in my like practice clinic area. And basically that's because I had a cesarean. And so they have to give me and my midwife the A-OK that I'm okay for a vaginal birth after cesarean. And so I went and saw him. He was pleased with everything, said I was a really great candidate. He was very intrigued by my birth, of having the boys, having one vaginal, one cesarean. But he, you know, he explained the risks to me of not having a repeat cesarean versus having one. But he said that I was a good candidate for a VBAC, and that he did advise that I really not go past 39 weeks, which I'm actually fine with. I really am like, okay, you know, if I'd never had a cesarean before, I'd be like, no, it's fine. I'm going to go until my body's ready to go into labor. But because I did have a major surgery on my uterus and my stomach, you know, I don't want to take any risks that a rupture could happen. It's a very small risk, but I just would feel awful if I was like, no, I'm not going to be induced. I'm not going to be doing this. And then something happened. I would feel terrible. I just want my baby girl to get here happy and healthy, and you know, however she gets here is fine. Obviously I prefer not to have a cesarean because I just don't want to have to go through that again. It wasn't the most horrible thing in the world, but I do have twins at home to take care of, and I'm gonna have a new baby. I want to be on my feet as fast as I can. So obviously, you know, doctor is going to tell you that, you know, it's safer to have a cesarean if you've already had one before. But he was fine with me going forward with the VBAC. Another reason that they don't want me to go past the 39-week range is because I do have gestational diabetes, and that can make your baby bigger. When I had my last appointment, which was like a week and a half ago, maybe 2 weeks, they looked at her and she was fine. I think they measured her in the 62nd or 67th percentile. So she wasn't like abnormally large. There was no concern at all that she was going to be bigger than normal, although they did say that she was already weighing at like 5 pounds. And I was like, oh my god, she already weighs more than Armour did at birth. So she is doing, you know, she looks healthy, she looks great. There's no concerns at all with her. I have another obstetrics appointment, which I'll have a sonogram on the 26th of this month, and so they'll look at her again and just kind of determine her size, kind of gauge, you know, where we're at. But I feel like, you know, I feel like she's going to be fine. I just feel like she's going to be a very healthy baby. I don't think she's going to be abnormally large. You know, I think she's going to be average. Let's see. So yeah, I have an appointment with obstetrics. I have my appointment tomorrow with midwives, and they'll just check me out, see how I'm doing. I think I'm probably going to have to take the GSB test soon, the swab where they test you to see if you're GSB positive. I can't remember exactly what it's called, but it kind of determines whether or not you need antibiotics while you're in labor, so that you don't pass any sort of anything off to the baby where they could get sick after birth, which I was positive whenever I had the boys, and I was totally bummed. I was like, oh, this sucks, you know, but if I am, I will take the antibiotics, because obviously, I mean, I don't want to risk anything. I did it before. It didn't cause any harm to me or the boys. So I will do that again. And let's see. I I think that's pretty much it. Overall, I'm doing really, really well. I have all of the normal end of pregnancy symptoms that one can have, but not like, I'm not, you know, it's nothing bad. Like I'm just gonna say it, and I don't mean to offend anybody by saying this, but man, a twin pregnancy is rough. Like, this pregnancy is tough. Like, there's everything about pregnancy is so, ugh, you know, it's draining, it's tiring, it's uncomfortable, it's painful. But when I think about being pregnant with the twins, and now I feel like this is more of a walk in the park. You know, it's uncomfortable, but it's not like that uncomfortable. So, and I don't know, you know, like I said, I don't mean to offend anyone by saying like, oh, a twin pregnancy is so much harder. I don't mean it like that. I just mean that, I don't know what I mean. I'm just saying that it's tough because it's at the end, but it's not, you know, it's not the worst thing in the world. So, but I've been having like restless leg syndrome, which I did have with the boys. I get that at nighttime, and that's usually what forces me to go to bed. Like, I sit in the chair and I have my leg, that's whenever, like after the boys go to bed, Josh and I usually have our show time where we'll watch a show or a movie or something together, and then we'll both have like our internet time for the day. So I'll get on Facebook and Instagram, and I'll watch my couple YouTube videos that I kind of follow. And but then my legs start to just, I feel like I need to get up, so then I wind up going to bed, or actually I say I'm going to bed, and then I go nest out in her room and just do things. And like, I've already got her, I've got a hospital bag packed, which I should probably do a video on that. I never did it with the boys, and I remember obsessing about the bag, the hospital bag. I just obsessed for days because I was on bed rest, so I just sat on the couch and repacked it and reorganized and repacked. So definitely a much smaller bag this time, now that I know what I do need and what I don't need. So I'll try to do a video on that, maybe soon. We'll see. But yeah, I have, you know, I have all of the end of pregnancy symptoms that you normally have. I'm tired, my body's achy, my pubic bone is probably the most uncomfortable thing. That's the thing that hurts the most on me, is my pubic bone. When I go from sitting or standing or anything like that, it's just like, oh, it hurts. I have been having Braxton Hicks contractions. Nothing severe, you know, nothing like excruciatingly painful or anything like that, just kind of uncomfortable whenever I stand up or I move, excuse me, or if I move around, it gets really, really tight in there. So I've been having that. I've been having a little bit of carpal tunnel, not bad. I feel like I was having it more, and then when I found out that I have the gestational diabetes and I had to like change my diet, I feel like that really helped it a lot. And to be truly honest, the gestational diabetes is kind of a blessing in disguise in the weight department, because I have been controlling my numbers and everything that I eat. I feel like I have really been able to maintain my weight gain. I've only gained like 32 pounds. I think I'm probably at 32 pounds for the pregnancy, which is amazing. I think that's great. I thought I was going to gain a lot more. I probably would have gained more had I not had to start watching my diet. And I really didn't want to gain a lot more weight, because I did gain quite a bit of weight when I was pregnant with the boys, and I didn't lose all of it. So getting pregnant again, I remember the first like 4 or 5 months of this pregnancy, I just felt so fat. I didn't feel cute pregnant. I felt fat because I still had all this weight from the boys that I hadn't lost, and here I am pregnant again. And I just felt really uncomfortable and not like, I don't know, I just didn't feel pretty. And you know, you feel that way when you're pregnant. You can feel, you know, sometimes you feel glorious and blissful and amazing and beautiful, and then other days you're just like, oh my god, I feel so gross. So I am at the point now though that like none of my shirts are fitting. Like they're all like kind of, they're not covering my belly all the way. So definitely very pregnant at the moment. So yeah, like I said, overall I'm doing great. Oh, the only thing of concern at this moment is that she is breech still. She doesn't want to turn. At every appointment I've gone to, she's been head up and butt down right in my pelvic area. And so last time when I saw my midwife, so it's like 2 weeks ago, I made an appointment with a chiropractor. I made an appointment, I saw them. They did some adjustments and things like that. The chiropractor did recommend, as I'm a little bit further, like 37, 38 weeks, to come in, and then they would really want me to come in like every day for like 4 or 5 days to try to do adjustments. And I'm kind of like, oh my god, my insurance sucks. Really, it does suck. And so it makes me a little concerned of like how much that's going to cost. And you know, obviously I want to do everything that I can to get her to turn. And so I've been on spinningbabies.com, and so there's a lot of techniques there that you can do to try to get the baby to flip. So I've been doing that. I've been doing inversions and different tricks and things like every single night, and I feel like she's just not moving at all. So my midwife did say that if I get to 38 weeks and she's still breech, that we can make an appointment with obstetrics and they will try to do a version. And that's where they will manually from the outside try to move her and flip her around, you know, not just like an adjustment, but they will like actually try to move her and turn her around. So I'm really, really hoping that she turns on her own and isn't forced. My biggest concern with her being breech right now is that if for any reason should I go into labor early, I don't want her to be in the breech position, because then that's like an automatic cesarean, and I just don't want that to happen. I don't want that to happen. So I'm gonna do everything I can to try and get her to turn. I may go see the chiropractor like 1 or 2 more times. I don't think I'm gonna go like every single day. Number one, right now with my schedule, it's really gonna be difficult to do that because I'm still working full time. And that, I mean, I was kind of, I don't know. I feel like if I were to go every other day, that would be kind of good, because then I can do the chiropractor thing and then do some stretches at home and try to get her to turn. So, but like I said, I'm doing stuff here at the house to try to make that happen on its own. I just hope it happens on its own. And if not, I'm going to do the version. And if she just doesn't turn, she just doesn't turn, and I will have to have a cesarean. I'm making peace with it in my head, so if that is the outcome, I'm not like devastated or just, you know, super bummed. Obviously, I just want her to get here, and I want her to get here safely. So it's not about me, really. It's not. It's about her. So I don't want anything. I don't want to risk anything. I just want her to get here safe as possible. So yeah, I think that's pretty much it. I don't think I have anything else to share. Like I said, the only thing of concern right now is that she's breech. So I'm just gonna try to see if I can get her to turn. I recently did have a baby shower. My best friend and my sister-in-law and my other best friend threw one for me. It was great. It was fabulous. It was just with my close friends and my close girlfriends and my family, and it was just so comfortable and so nice and so different than having the boys' baby shower, because this isn't my first time at the rodeo. This is my second time, and it just felt really good and very relaxing, and I just felt a lot of love from my girl tribe that surrounds me, and I just feel ready. I'm really ready for her to be here. I'm trying to absorb these last couple weeks because this is my last pregnancy. Excuse me. So I'm trying to really soak it all in, and, you know, just remember that even though it's kind of uncomfortable right now, this is it. This is the last time I'm going to be pregnant. So trying to just really make sure that I soak it all in and remember, and, like, you know, just be appreciative of every moment of this pregnancy, because, you know, sometimes women don't get to experience that. Some women become mothers but don't experience pregnancy, and, you know, it's such an incredible experience that, you know, I don't want to take any of it for granted. So I think that's really it. I'm kind of out of breath from talking. So like I said, I am 35 weeks. I have probably about like 4 weeks left. I am officially going to, I haven't told my boss yet, but I think he kind of knows. My last day of work is going to be the 31st of October, Halloween. And that'll give me, you know, a good like week and a half before she's officially going to be forced out. So I'm kind of excited about that. I'm ready for maternity leave. I am going to try to take my full 12 weeks. I will not be getting paid for it. We have been preparing and stuff like that. So I have like some vacation time and a little bit of sick time that will help me get through that, but I'm not going to feel bad about taking my full 12 weeks and being on maternity leave, because I deserve it. So, and I want to spend as much time with her and the boys as I can. I'm really excited to just be home with them for a while. But yeah, I think that's it. I'm going to go ahead and end the vlog here. If you have any questions, leave them below. I am going to attempt to do a video every week now, since I am at the very end, to just give like a quick update. I'm also going to try to do a hospital bag, and I will do a little nursery tour so that you guys can see her room. It's almost complete. And then I'm going to pop a picture in here at the very end, so you can see what her name is. No big name reveal. I wanted to do something fun and cute, but I didn't have it in me. So I'm going to do a quick bump shot and we'll be good to go. And I'm on the floor, so we'll see how this goes. But this is me, 35 weeks. And she is nice and it's pretty round. Yeah, that's it. I hope you all have a great day, and I'll see you soon.